Hello. For this project, I decided to do XYY syndrome. XYY syndrome is a rare chromosomal disorder that only affects males. Usually, in a male, there is only 46 chromosomes, and the sex chromosomes are X and Y. In a male with XYY syndrome, I guess the name says it all, is a male with an extra Y, hence the XYY. The exact reason for the cause of this is not yet determined, but they do know that it is caused by cell division error in the cell during meiosis. A little background about XYY syndrome is that it cannot be inherited. Even though the cell division error does come from the sperm cell and that comes from your father, it's not inherited. It does not come down through generations. It only occurs through chance. Now, as I said before, the exact reason as to why there is an error in the sperm cell is still unknown. XYY syndrome occurs in 1 to 1,000 newborn boys, and from that, 5 to 10 boys are born in the USA each day. XYY syndrome phenotypic features are normally not seen from birth. A lot of people do not know they have this until they get it tested for a secondary reason. Some of the major phenotypic features are that they are taller than average males, they have learning difficulties or speech problems, and are kind of socially shy, so they are sometimes diagnosed with autism. They do have weaker muscles and bones, and sometimes will even have delayed puberty. When they get older, they will have low testosterone counts and probably be infertile. A lot of parents might not be aware that their child has XYY syndrome. They might go to the doctor and get misdiagnosed for autism, but in reality, there should be a chromosomal test done to ensure that it is nothing more. Because XYY syndrome is a genetic disorder, there are several ways that you can check to see if your child might have XYY syndrome. During pregnancy, you can do an amniocentesis to do a full chromosomal study even before your child is born. There are some dangers to doing this, but it might pay off in the long run if you do want to know if there are any chromosomal mutations in your child. After birth, it can also be diagnosed through clinical evaluation. Through running tests like hormone testing and chromosome analysis, you will be able to know if they have an extra Y chromosome. Hormone tests also help because people with XYY syndrome usually have lower testosterone levels. The most common case studies that comes by with XYY syndrome is people not being aware that they have XYY syndrome. For example, in this case study, a boy was born with a heart defect and had a pacemaker placed in his heart right after birth. At 3 years old, the boy went to the doctor with childhood acne. The doctor thought that he had a genetic mutation that causes heart defects, so he ordered a chromosomal analysis. When the analysis came back, the doctor realized that he did not have this gene that caused a heart defect. Instead, he realized that he had an extra Y. This answered a lot of the questions that the doctor had about the child. He came in with childhood acne, and according to his mother, he also was very shy and was even autism-like. Just as in this case study, there are several cases where people are unaware that their child has XYY syndrome. They might think that they're just naturally shy or naturally tall, but there are other reasons to this. Unfortunately, there is not a cure for XYY syndrome yet, but there are medications and treatments that can help the side effects that come with XYY syndrome. Speech and occupational therapy help with the learning disabilities that come with having XYY syndrome. Sometimes they have attention deficit, which can still be treated with medications that a normal individual would have too. Some individuals will need hormone replacement and therapy in order to increase their sperm count. For some men who are trying to conceive, will maybe need fertility treatment because of the low sperm count. Along with medication and treatment, some individuals might have what is called gynecomastia, which is excessive breast tissue, and if they want to, they can have surgery to remove that. Overall, the symptoms of XYY can be managed with the right medicine and treatment. And as I mentioned before, XYY syndrome is not inherited, so it is not passed down. All men have an equal chance of getting XYY syndrome. This is my phylogenetic tree for the MECP2 gene, which may cause XYY syndrome. And as you can see, there are several primates in the tree, but only a few of them are closely related to humans. I hope this video has given you some new knowledge and understanding about this rare genetic disorder.